today's video, I'm bringing you a very quick but very interesting case about a man suffering from elbow pain. This was a 41-year-old male patient, and he trained Brazilian Jiu-Jitsu. And during one of his trainings, his arm got overly stretched, his right arm, and he started feeling elbow pain. This pain had been going on for more or less 2 weeks before he came to see me. He had pain almost in every situation, but it was worst on movement, and especially it was worse if he tried to use force with his arm. So if he tried to stretch it or bend it against resistance, he would feel a lot of pain. As I was questioning him, he told me that the pain was more on the inner side of his elbow, going all the way to the back of the elbow. So if we think about the channels, we'll probably have an affection of the heart meridian, but also of the small intestine meridian. And this was my conclusion, that both of these channels were probably affected. If you'd like to learn more about the techniques that I show in my videos, check out the courses I have available. I have balanced method acupuncture courses, both in English and in Portuguese, that you can purchase and learn about this technique. As the elbow is kind of a complex joint because we have 6 channels going through it, and sometimes with the movement it's hard to determine exactly where is the pain, and the patient had quite a lot of inflammation. It was still a more or less recent injury, and it was hard for him to describe to me how the pain was. So I decided to use ear acupuncture to try and relieve some of the symptoms and then more or less clear the field so it would be easier to work on the meridians later. And the patient had something that was very interesting. I was going to look for the area of the arm and specifically the elbow. So if you remember your ear acupuncture points, the arm starts more or less around here. It will go like this where you have the elbow, and then it will go like this where you have the forearm and then the hand. The patient had a very thin and very red vein that stretched exactly from the point where the elbow is all the way more or less into here. And this was very interesting to me. Why? Because number one, of course, we have here the point for the elbow, but in here we have a Master Tung point numbered 99.03 or fire ear, and this is a point that is used to treat the heart according to Master Tung. Along with treating the heart, it also treats the knee. We're treating the elbow, but if you know the balance method and if you know Master Tung acupuncture, you know that a lot of times something that will act on the elbow will act on the knee and vice versa. So this vein joining the classical ear acupuncture point for the elbow with a Master Tung point that treats the knee and also one of the channels that was affected was very interesting to me. So what I did was bleed this vein. So bleeding on his ear, and this again was the right ear, the same side as the affected channels. After bleeding this vein, I asked for the patient to evaluate how he was feeling his arm, and he told me that if the arm was not moving, he was no longer feeling the same discomfort that he was feeling before we bled this point. After that, I decided to try some movement. So I asked him to bend his arm and stretch it, and it was no longer hurting. The next thing I did was to test the movements against resistance, because this was the most painful thing for the patient. So what I would do is I would hold his hand in my hand and make him stretch or bend his elbow against some resistance. Nothing very strong, but enough to make him work. And like this, there was still pain. According to him, less pain than in the beginning, but there was still pain, and now the pain was more located on the outside of the elbow and not so much in the middle part. So I consider that the heart meridian was more or less resolved, and I focused on the small intestine meridian. For this, I used two different techniques at the same time. The first thing that I did was to go to the opposite side knee and look for Ashe points around the liver channel. If you know the balance method, you know I could have used a lot of different channels here. I could have used the spleen, I could have used the bladder, I could have used the liver, and even the kidney. Why did I go to the liver channel? Well, because if you think about the mechanism of injury, it was overstretching his arm. So what's more likely to be injured is something related to tendons or ligaments, and as we know, the liver is very important in treating tendons and ligaments. So I found one point that was very painful around liver 8, and so I needled that point very deeply. So a point, not exactly liver 8, but a point around liver 8, and this on the opposite side. So I was treating his left knee for his right elbow. Again, I asked him how he was feeling, and he told me that without movement there was no longer any discomfort. And then we tried again the movement against resistance with my hand holding his, and the patient told me that it was a lot less. Now there was no pain, but he still felt like the elbow was not stable, like the elbow was going to break open at some moment. So what I decided to do was to add the guiding needle or the shoestring point for the affected channel on the affected side, in this case small intestine 3, on the affected side. So this was on the right side. Just to recall, I bled the ear on the right side, the same side as the affected side. I used the point on the knee on the opposite side, so the left, and then I used the guiding needle on the same side. I didn't do any more movements against resistance because with the needle on small intestine 3 it might be painful for the patient, but I asked him to move his arm a couple of times during the needle retention, which was more or less 30 minutes. After the 30 minutes, I took out the two needles we had on the patient and I asked him to try the movement. He told me everything was okay, and then we did the movement against resistance, and the patient told me that there was no pain, no discomfort, and not even that feeling that the elbow was not as strong as it should be. So we finished the treatment like this. After this, I didn't book a second session with the patient because I suspected that this treatment would be enough to solve the problem. So what I did was I called the patient on the next week, more or less after 1 week of treatment, and asked him how he was feeling. He told me that he was back to training Brazilian Jiu-Jitsu and that his arm had no more pain. Again, as I told you in the beginning, this is a more or less simple case, but it's only simple because we have these techniques in our pockets. If you look at what we did, we used a combination of the balance method, of ear acupuncture, and of Master Tung acupuncture. We used acupuncture and bloodletting techniques. And this is why it is important for you to have a wide range of techniques that you are comfortable with, because this is what allows you to take a complex case and make it simple. So again, the elbow is a joint that I know a lot of times brings a lot of problems to acupuncturists. We have two affected channels, and especially in the beginning, a pain that might confuse you because it was not very specific, it was not very easy to locate. It was also dependent on movement, but using these technique combinations, you can see that with only two needles and some bloodletting on his ear, we were able to completely solve the problem in only one session. If you like this video, don't forget to like and subscribe, and I will see you next time.